make sure that the splint itself goes from the joint above the break to the joint below the break. This is always better with two people. But if you find yourself alone, you're going to have to make do. When applying the triangular bandage, you can do a simple overhand knot. I like to do it twice, because when you pull, it stays in place. Then you can turn that into a square knot, just making sure it's on the rigid side. Place the next one above the break. And make another square knot. The patient can be transported. You're going to slip this underneath the patient's arm and tie it in a position of comfort. You may need to pad this area. You'll have a little bit of triangular bandage left over on the end near the elbow. You can simply just tie it up like this. And if this does not hurt the patient, you can actually cradle their hand with it. Make sure you tie the knot on the uninjured side. You can check a radial pulse. Can you feel me touching your fingers? And can you move your fingers, please? You can use tape. In this case, I'm going to use cravats. And you're just going to wrap above the joint. And when tying your knot, make sure that you tie the knot on the rigid side of the splint. You'll also want to place a cravat above the area of the break. Easiest if you wrap this part twice. This will actually hold your original overhand knot. And I'm actually putting a square knot into these. And also place a cravat below the break. Once again, I'm going to do an overhand knot twice. And then do it the other way for a square knot. Once you're done splinting, it's very important to make sure that you check for pulse, motor, and sensory again. So feel for a pulse. Can you feel me touching you? And can you move your toes?
Common injury in contact sports. If enough force is applied to the shoulder when the arm is in a vulnerable position, the humerus or ball can pop out from the shoulder socket. This is called a shoulder dislocation. The ball can fall forwards, backwards, or downwards. The most common dislocation is when the ball falls forward, injuring the labrum and surrounding muscles and ligaments. With severe dislocations, not only is the labrum torn, but the humeral head collides with the edge of the cup, denting the ball. Your physician will help determine the best choice for you. You will be asleep during the surgery with general anesthesia and given a nerve block to minimize pain after the surgery. To begin the surgery, several small incisions are created for the instruments and the camera. Once inside, The surgeon will examine your shoulder for any damage and address it as needed. The torn labrum is freed from the edge of the bone where it is trying to heal in a poor position. The bone is prepared. Sutures are placed around the labrum and through the capsule. Holes are created. The sutures are pulled through the anchors. Then, the labrum is pulled into the correct position and held in place with the anchors. If the dent in the ball is too large, the surgeon may fill it with local tissue. An anchor is placed in the ball, and the local tissue is pulled tight into the dent. The surgeon will test to make sure your shoulder is stable before the surgery is finished. After surgery, you will be in an arm brace that always stays on except during physical therapy and bathing. 2 weeks later, you will begin physical therapy. After about 6 weeks, you can remove the brace. On average, our athletes return to non-contact sports after 5 to 6 months. For contact sports, it is typically 6 to 9 months, depending on your surgeon's discretion. For more information, visit the Children's Hospital Colorado website.
You should look for pain and tenderness, difficulty moving, swelling, and bruising. If someone has a sprain or strain, you should remember RICE, which stands for rest, ice, comfortable support, and elevation. If someone has a strain or sprain, help them to sit or lie down and support the limb in a comfortable raised position. To cool the area, apply a cold compress like an ice pack, cold pad, or frozen peas wrapped in a towel. Leave the ice pack or cold pad in place, or wrap a soft layer of padding like cotton wool around the area. Then tie a support bandage around the area to hold it in place. This needs to go up as far as the next joint on each side. Raise the injured area and support it with something soft like a cushion, or in this case, you can use a sling. If the pain is severe or they can't use their limb, they will need to go to hospital. Otherwise, just tell them to rest it and to seek a healthcare professional if necessary.